So recently I was starting my shift in the emergency department, and at a handover, the other team was handing over a patient to me that had come in with increased work of breathing and hypotension. They weren't really sure what the cause was at that time, but they were sure that the patient was in shock and they were treating appropriately. So after handover, I went in to see the patient. I did an assessment and was looking over their vital signs with the critical care team, which was there to see the patient as well. So at that point, the critical care team thought that the blood pressure looked a little bit better and that the pulse pressure wasn't as wide anymore, and that clinically the patient looked a little bit better, and that they wanted to give more fluids and send the patient to the ward for further observation. So, I thought that this would be a really great time to use point-of-care ultrasound sort of guide further therapy for this patient. So when I took a look at the IVC, I actually found that it was quite large and plethoric in comparison to the aorta, and that it was collapsing less than 50%. So then I took a good look at the heart. Heart overall had normal function and looked normal. And then finally I looked at the lungs. So when I looked at the lungs on both sides, I found quite a few B lines throughout. So I thought that this was really useful information because although this patient probably does need more fluids, she's got quite a bit already. And that another step in her therapy, or another adjunct for her therapy, will probably be to add vasopressors to her therapy, because her lungs at that point looked bad because they had B lines, meaning that there was fluid in them, that they should be really careful and judicious with their further fluids that they give this patient when they're treating her later on in the ICU. So I thought this was a really good example of using point-of-care ultrasound to help guide further therapy for our patients in resuscitations, and also to show that it helped guide where this patient will need to go for further treatment as well.